Okay.
Good afternoon, all of you. On behalf of Indian Medical College, I welcome all of you to this interesting session in pediatrics on nutrition. Today we have for talk Dr. Satish Tiwari, very enthusiastic professor of pediatrics from Amravati. He has been founder president of Indian Medical Legal and Ethics Association, founder convener of Human Milk Banking Association of India. So he is the right person to talk about nutrition and breastfeeding. Good afternoon, sir. I welcome you to this interesting session. I hand over the session to you, sir.
Good afternoon, Dr. Balaji, and welcome to all the students who have joined today's session. Today I will be talking something very basic about the nutrition. And as we all know, in the present pandemic due to corona, it is said that at present we do not have medicine, neither we have the vaccine for against the corona. And that's why the body immunity is the most important protective factor. And body immunity is basically dependent on the nutrition of the body. So when we talk of nutrition, something very basic which we must know is that there is a what is called as complete food, balanced food, and then of course the various components of the nutrition. Now let us understand the difference between a complete food and a balanced food. A complete food means a food which contains almost all the ingredients like carbohydrate, protein, fat, minerals, vitamin, fibers, water, etc. That is a complete food. And a balanced food means that all these components should be in proper amount. So that is a balanced food, and complete food means all the things will be there, but they may not be in proper proportion or proper amount. To take an example, milk is a complete food. It contains almost everything for protein, carbohydrate, fat, minerals, vitamin, water, but it is not in a balanced form. The milk contains more of the protein as compared to the calories. So that's why the milk has to be made a balanced food whenever we consume the milk. How to make it balanced, we'll discuss subsequently in today's talk. Nutrition, when we discuss, the first thing is the first feed should be given as early as possible. That means after birth, the breastfeeding should be given as early as possible. We will discuss how to give the breastfeeding at the earliest. The feeding has to start early in low birth weight babies. That means babies weighing less than 2.5 kg. The body requirement in the first month or in the first week of the life, the fluid requirement is around 150 to 200 ml per kg per day, maybe oral or through intragastric feed. If we go for the IV fluid, the requirement is about 125 to 150 ml per kg per day. The caloric requirement, especially in the first few years of the life, is around 110 to 120 calories per kg per day. There are different formulas which we'll gradually discuss when the classes progress. Protein requirement in children is around 2 gram percent, and in adult it is 1 gram per kg per day. So protein requirement is more in children, and in first year it's almost 2 grams per kg per day. The feeding or the nutrition can be provided to an individual either through the oral route, intragastric tube, or nasojejunal tube. The various foods which are available, especially in the infancy or in the neonate period, is breast milk, express breast milk, cow's milk, buffalo's milk, or formula milk. This sequence is probably in the same sequence as it should be preferred. So formula feeding should be given at the end if all others are not available. The nutrition can be given intravenous also or total parenteral nutrition also. Let us see this very important slide, and what information we gather from this slide is the breast milk is tailor-made as per the need of the offspring. And you can see in the photograph, a cow's offspring is drinking cow's milk only, a zebra offspring is drinking zebra milk, a dog offspring is drinking dog's milk. So only in the human being where we say the prefrontal lobe is very much developed, the human being, many times they do not feed, mother does not feed the baby, and we give milk other than the mother's milk, that is animal milk or formula milk, which is basically against the nature because it is not as per the nature's things, because the mother's milk is not only species specific, it is also gestation specific. So this we have to keep in mind. The recommendations, especially in the first 1,000 days, you can see this photograph here. The first 1,000 days includes 270 days of the antenatal period, that is pregnancy, 365 days in the first year, and 365 days in the second year, and like that. And when we say feeding, the first hour is the golden hour. It is named as golden hour because you have to start breastfeeding maximum within the first hour of after the birth. Once you start feeding in golden hour, exclusive breastfeeding has to be given for 6 months. After 6 months, there has to be complementary feeding, but breastfeeding has to be continued. And this breastfeeding has to be continued minimum for 2 years. It can be more, but it should not be less than 2 years. During feeding, whether it is breastfeeding or complementary feeding, mother should be interactive with the child. She should converse and communicate with the child. This is known as interactive feeding, and this stimulates mental as well as emotional development of the child. We must understand some of the basic concepts, and we have to follow what is known as rooming in and bedding in. Rooming in means mother and baby are kept in the same room so that whenever baby cries or whenever mother feels, she can go to the baby and she can feed the baby, or she can take the baby and feed the baby. But better than rooming in is bedding in. Bedding in means mother and child in the same bed. So mother does not have to get down from the bed, or there is no need for somebody to bring the baby to the mother. Whenever mother wants to feed the baby, she can take the baby and feed the baby directly as they are on the same bed. This protects hypothermia because mother's temperature, skin to skin contact will all protect. And of course, as we know, as a medical person, there are commensals on the mother's body, and baby will be exposed to that commensals first and not to the infective bacteria or viruses. So these are the all advantages. Another thing related to this is what is known as kangaroo mother care. Not only kangaroo mother care, now we have kangaroo father care or kangaroo family care, where any family member can give the baby the kangaroo care. Now we'll see this small video how early breastfeeding can be started. Can it be started on the delivery table itself?
The baby has cried and started breathing well. Baby is shown to the mother and kept close to her with a cheek-to-cheek contact. This helps the mother to kiss the baby and also facilitates the local custom of saying a holy message in baby's ear. Subsequently, baby is kept prone in between the breasts. All care should be taken to prevent the baby from falling. If the weather is cold, then baby should be covered with a warm cloth. Baby is very alert soon after delivery and hence is at its instinctive best. Baby is also kept warm, being in close contact with the mother. Baby is also prevented from future infections because she starts acquiring healthy germs which will colonize her skin and intestines. Thus, this position ensures early instinctive stimulation and gives warmth, love, security, and also food. It also initiates bonding process between the baby and the mother. Kicks will give tender, firm jerks to the womb, stimulating it to contract. This will help to expel placenta and bleeding. Once baby realizes that food is in close proximity, it starts salivating. Smell is a strong stimulus which drives the baby towards the nipple. Baby's smell sensation is well developed. Smell of a chemical on nipples is similar to the smell of a chemical in amniotic fluid, which surrounds the baby in the womb. Mouthing movements start. Her shoulder, hip, and neck muscles are sufficiently developed to help her move. Baby with her limited vision can see the ampulla. If baby raises her head, it can also see mother's face. Baby has reached the nipple, has raised her head, and has nicely lashed it with wide open mouth and mouth full of breast. What a beautiful moment of joy.
So I think this video very clearly shows that baby can be fed on the labor table or the delivery table itself. There are distinct advantages of this feeding early, and this is the golden hour and the first hour in the life, first hour of feeding of 1000 days. So this is very important. We have all seen the advantages. Even if it is a cesarean section delivery, you can feed the baby from the side. So you cannot keep the baby on the abdomen of the mother, but by the side you can keep the baby, and some relative or the nursing staff can hold the baby, and baby can be fed from the side of the chest wall. Now when we come to the breastfeeding, there are a lot of advantages of the breastfeeding. If you want to take one full lecture, it can be there on the breastfeeding advantages, but we'll discuss these advantages in 1 or 2 slides. The first and most important thing, it is natural, instinctive, and physiological. We have already discussed it is a species specific for each and every mammalian. So every mammalian's milk is specific as per the need of their species. It is free from contamination and adulteration. It is available at desired temperature, so no need to boil, no exposure to foreign protein, no need to calculate how much milk should be given to the child. Baby automatically sucks as much as he wants. It is cost effective as compared to any other milk. The lactational amenorrhea helps in child spacing, so it is a benefit to the mother also. Other benefits to mother include postpartum involution of uterus, decreased postpartum hemorrhage, body figure is restored earlier if mother breastfeeds the baby, and it protects the mother from breast and ovarian malignancy. The immunological advantages of breast milk include, there are so many advantages that some of us have labeled it as a white blood or as a first vaccine for the baby. The advantages include the colostrum is very high in IgA, IgG, and IgM antibodies, which protects from GIT or respiratory infection. There are cells like macrophages, lymphocytes, and polymorphs. The complement activator factors C3 and C4. The lysozyme, lactoferrin, and lactoperoxidase in the breast milk, it helps in lysing the microorganism, thus preventing the various infections. There are specific inhibitors against antiviral and antistaph. The growth factor for Lactobacillus Bifidus, and of course para-aminobenzoic acid, which protects against malaria. So these are all immunological advantages of breast milk. The biochemical advantage, the protein is 1.1 as compared to cow's milk where it is 3.3 gram %. And this 1.1, as we are repeatedly discussing, is species specific as per the need of the newborn child, while 3.3% is almost 3 times more as compared to the requirement of the child. Then in human milk or the breast milk, there is lactalbumin, which is a whey protein, while cow's milk contains casein, which forms precipitate or gets precipitated in the abdomen. Amino acid pattern are better suited in human milk as compared to the animal milk. Another important factor in mother's milk is lactose, which is 7%, which gives it more sweetness, increases the calcium and iron absorption, while it is only 4% in cow's milk. Fat is almost same in animal milk and the mother's milk, but in mother's milk, the linolenic acid, the galactolipid is more, and this helps in better CNS growth. If you look at the mineral content, it is 0.2% in mother's milk, and electrolytes, though they are less, but they are in a proper form and better absorbed as compared to 0.7% in animal milk, and this increases solute overload. Calcium phosphorus ratio is 2:1 or more in breast milk, which increases the better absorption of the calcium, while it is less than 2:1 in animal milk, and this is one of the cause of increased incidence of tetanus. Hematinics like iron, folic acid, vitamin C, they are either more or they are in better form in mother's milk as compared to less amount or poor form in animal milk. The one of the disadvantage, if somebody asks, is vitamin K is less in mother's milk as compared to animal milk, and this may be the one of the cause for increased incidence of hemorrhagic disease of the newborn, and in some cases the breast milk jaundice can be there. So if the baby is on mother's milk, the incidence of these two diseases will be more, but we have seen there is lot of advantages, and these two disadvantages are overweighed by the advantages. While if you are giving animal their milk, there is problem of milk allergy, iron deficiency anemia, acidosis, and as we already discussed, tetany. The other advantages of breastfeeding, it stimulates emotional bonding between the mother and the child. Breastfeeding contributes to IQ. It is said that IQ is about more by 3 to 7 units or 3 to 7 points in those who are breastfed. Visual acuity is better. Mathematical abilities and analytical capacity is better in a breastfed baby. It also prevents childhood obesity and of course the later onset obesity, the incidence of diabetes, other chronic problems, asthma, allergic disorder, ear infections, chronic celiac disease, everything are less in breastfed babies as compared to the animal or formula milk babies. And of course, the last and very important advantage is the breast milk is eco-friendly. So there is no need for any boiling, there is no need for any gas or fuel, there is no need for cleaning the bottle and all this. So all these advantages are there with the breastfeeding. Now, as we said, does it require a special preparation for establishment of breast milk? We already said it is physiological and instinctive, so there is no need, it is natural. But still we have to take some care during antenatal period. And the most important thing which we have to take care, we have to motivate the mother and the parents, because most of the time they may be undecided whether to give breastfeeding or to give formula milk, which is by the various multinational companies is projected as a very good substitute for mother's milk. But please remember, there is no substitute for mother's milk. The confidence of mother is very important, including the confidence of obstetrician and pediatrician who are contacted by the mother. Information and education regarding the breastfeeding practices should be given. If there is retracted nipple, it should be diagnosed, but correction should be avoided, because many times the retracted nipple, they get corrected automatically during the lactation. Vigorous cleaning of the breast is to be avoided because it can lead to cracked nipple. And the most important thing, as we said, is the confidence of the mother that after delivery she can breastfeed her child properly. So you have to convince that you are competent enough to breastfeed your baby, and if there are some problems, we are there to help you. So it's very important to counsel and increase the confidence of the mother. This is prolactin reflex. You must have learned in neurology or during physiology. I'm not going into the detail, but this is also known as milk secretion reflex. There are enhancing factors like emptying of breast, suckling at the breast, expression of milk, and night feed. So it is very important to feed the baby during night hours. And there are hindering factors which will decrease the breast milk secretion, and it includes positioning, painful breast, bottle feeding, all this. So prolactin reflex is related or is associated with milk secretion. And we have oxytocin reflex, which is also known as let down reflex. And this is important for the expression or let down or ejection of milk from the breast or from the areola. Please remember, nipple has no role, only nipple has no role. It is the entire breast and areola which is required for proper breastfeeding. We'll see that in positioning. So when a mother thinks lovingly of a baby, when mother is confident, the sound of the baby, the sight of the baby will all increase oxytocin reflex, while stress, doubt will decrease the oxytocin reflex and the let down of the milk. So we have to remember these two important reflexes. This is what we are discussing. If you see the first photograph, where you can see that in the first picture, the baby is feeding at the whole of the areola. So almost the entire areola is in the mouth of the baby. While in the second picture, which is a wrong position or attachment, the baby is suckling only at the nipple. So this will not help the baby in extracting the milk from the breast. Baby becomes irritable and then the problems start. So for a proper breastfeeding, the child must have the areola of the mother in his mouth. Then only he will be able to feed the baby. It's very important about the attachment. Now the various position, you can again see the 5 photographs in which mother can feed. There is a cradle position, cross cradle position, football position, and even in lying down. Now many people have confusion in the mind that if the mother is feeding the baby in lying down position, there is every possibility that in the sleep, mother will roll over the baby and baby will die because of the asphyxiation. This is scientifically not proved. Practically, it is very rare. We will not say that it cannot happen, but most of the times, mother is not that much in sleep that she will roll over the baby and she will not know that baby is by the side. So, though there is a possibility, but please remember, do not avoid sideline hold or sideline position, because many times during sitting position, mother may have discomfort. So mother can feed the baby in sideline position. Only thing is you have to be extra careful that mother is not in deep sleep. So position, what should be position? The mother should be comfortable, relaxed. There should be adequate rest to the back of the mother in the sitting, standing or sleeping position as we have discussed. And baby's position during feeding, as we have discussed, again will depend on the which hold is there, including the football hold. And after each feeding, the burping has to be done. And after burping, the baby has to kept in right lateral position for 10 to 15 minutes. After that, baby can be in left lateral position or in supine position. The factors which affect the secretion of the mother's milk, the factor which increase secretion are suckling. We have already seen the let down reflex, the complete emptying of the breast at each feeding. So if mother feeds baby till the complete emptying or till the baby leaves the breast of his own, the secretion will go on increasing. If mother does not feed the baby, she feeds from the bottle or the formula milk or with the spoon, then the milk will remain in the breast, and the reflex that goes to the brain is that there is adequate milk for the next feeding and do not increase the secretion. So secretion will gradually go on decreasing. The drugs which can be used for increasing the breast milk secretion, the most commonly used drug nowadays is Domperidone, which is an antiemetic. So you have to clearly tell the parents or the relatives or the mother that though this is an antiemetic drug, it increases the breast milk secretion. Another antiemetic drug, Metoclopramide, the Chlorpromazine, and there are some Galactogogues. So these drugs are known to increase the milk secretion in mother. Two important words again which we must understand is re-lactation and induced lactation. Re-lactation means for any reason if mother has decreased or stopped the breastfeeding and she goes to a proper doctor who is motivated in promoting breastfeeding, you can again start the feeding in the same mother in the same delivery. So this is known as re-lactation. You have to re-stimulate the breast milk secretion. We already seen you can use the drugs. Repeated suckling is important and complete emptying is important. Induced lactation may be tried in mother who has not delivered that baby. So it may be grandmother, it may be adopted child by adopting mother. She can also be given these medicines. She can ask to increase the suckling at the breast, and this may induce the lactation, and this is known as induced lactation. The factors which decrease the secretion are reluctance in feeding, prelactal feeds, that's why we say prelactal feed should not be given, pacifiers used by many mothers, if there is anxiety, discomfort or emotional stress in the mother, if there is decreased food and fluid intake by the mother, and of course the maternal malnutrition, though is not supposed to decrease the amount of milk, the quality may suffer. So the contents of the milk may be less, but the quality of milk will usually remain normal. And position we already discussed. If the position is not proper, it may result in decreased secretion of the milk. The most important problem with most of our mothers is that they are not confident that they have adequate milk. And when they come with this complaint or they go with this complaint to any of their relatives, to most of our colleagues, that is doctor colleagues, the simple answer is okay. If you have less milk, you start the top milk or the animal milk or formula milk. Please remember, excessive crying is not a sign of inadequate milk. So, how to know whether the mother is producing adequate milk or not? If the baby is passing urine more than 6 times in 24 hours, please remember it is not day, it is 24 hours. So if you are now trying to count at 4 o'clock, tomorrow till 4 o'clock afternoon you have to count, and the urine output should be more than 6 times in 24 hours. You have to be very careful, otherwise in summer months the urine may dry up, the clothes may dry up, and you can miss the frequency of the urine. If the baby is active and playful, if he spontaneously releases the breast at the end of each feeding, please remember, crying is not a sign of inadequate milk. Rather, crying during the night hours is normal. Most of the baby, they sleep during the day and cry during the night. And if mother and baby do not have any obvious problems like cracked nipple or some abscess or cellulitis of the breast, it indirectly means there is no problem of the adequacy. And the most important objective criteria to know the adequacy is proper weight gain by the child. So you have to know you have to maintain the weight record, and if the baby is gaining weight as per the scheduled weight gain, then probably he is getting adequate milk. Now, if there is inadequate milk for any reason, what we should do? Should we advise directly formula milk or animal milk, or we have some other options? We already discussed the inadequacy of milk is very, very rare, maybe 1 in thousands or in lakhs or in millions. The reason is very simple. We have said breastfeeding is natural, physiological, and instinctive. So unless and until there is some pathological disease in the mother, the breastfeeding usually is not affected. So this pathological abnormality can be anatomical or endocrinal abnormality. As we have discussed, the faulty position may decrease the milk secretion, so you have to correct the position. Top feeding by giving the animal milk or formula milk will decrease the milk secretion further, so it should not be done. If you are bottle feeding the baby, it will result into nipple confusion, and again it will result into decreased secretion. So what to do if there is a diagnosed case of inadequate milk? You have to correct the position, give breastfeeding more frequently. So don't give top milk or the formula milk. Continue breastfeeding and increase the frequency. Treat the abnormality or the disease if it is there. And of course, as we discussed, we can use Galactogogues. The feeding schedule, there are different schedules. Demand schedule, that means whenever baby demands, or there is a fixed schedule every 2 to 2.5 or 3 hour mother feeds the baby. Some of us believe into semi-demand schedule. That means sometimes when baby demands and sometimes at a fixed schedule. So which schedule to follow? Demand, semi-demand or fixed? It will depend on mother and child's comfort. Usually 2 to 3 hourly feeding is ideal and best, and even during night hours. So you have to keep in mind that it does not mean every 3 hourly fixed schedule. Sometimes it can be 2 hourly, sometimes it can be 3 hourly as per the child's requirement or demand. Now, how to understand the child's demand about the feeding? So we now say that there should be feeding on cues, and there are early cues and the late cue. Crying is a late cue, so please do not wait till the baby starts crying. You have to feed the baby on early cues. Early cues means the baby becomes awake, starts moving his limbs, starts moving his lips, looks here and there. He starts looking here and there to find out whether the mother is nearby or not. And all this should be taken as a early feeding cues, and breastfeeding should be given. Please do not wait till the baby cries. Very important point again, are there any contraindications for breastfeeding? For all practical purposes, if somebody asks me, is there absolute contraindication? I will put a big question mark. According to me, there is no absolute contraindication for breastfeeding. Of course, some may say that HIV, some may say galactosemia, lactose intolerance is a absolute contraindication. According to me, these are all relative contraindications. We should see if it is possible still to feed the baby without any major complication. So relative contraindications include HIV and AIDS, postpartum psychosis, critically or seriously ill mother, like if you see suffering from congestive cardiac failure, chronic renal failure, acute renal failure, hepatitis B, or hepatic encephalopathy, etc. If the mother is on drugs like radioactive drug, anti-malignant, anti-thyroid drugs, tetracycline, again, these are supposed to be relative contraindication and not absolute contraindication. As we said, galactosemia is one of the conditions in which there can be absolute contraindication, but please remember this is very, very rare condition. So it's not that common. Before stopping the milk, we have to be very careful in diagnosis and confirming the diagnosis. Lactose intolerance, again, if it is not very serious, if it is not very severe, and if the baby is gaining weight in spite of the increased frequency, it should be continued. So lactose intolerance, especially the acquired lactose intolerance, is not a contraindication for breastfeeding. Of course, if the baby has genetic lactose intolerance or severe lactose intolerance since birth, which is hereditary, then we can think of stopping the breastfeeding. The last line is very important. Inadequate milk. Now what happens in practice, the most of the mothers or the parent, if they have feeling that the child has inadequate milk, they stop the breastfeeding and they start bottle feeding or formula milk and animal milk. Please remember, inadequate milk is not an indication for stopping mother's milk. Rather, as we discussed in previous few slides, if there is inadequate milk, mother should feed the baby more frequently. So if she was feeding 2.5 to 3 hours, it can be 1.5 to 2 hours. There should be complete emptying of the breast. And of course, as we said, we can use Galactogogues and we can re-lactate the mother if she is already not giving the complete breastfeeding. Feeding problems in mother, we will not go into detail. This is a gynae or obstetric field. Or in mother, it can be blocked duct, mastitis, retracted nipple, engorged breast, abscess, abnormalities of the breast, sore nipple or fissured nipple. The most important thing is to treat and prevent these conditions. In primigravida, one of the causes for feeding problem can be lack of experience, lack of confidence, anxiety and emotional stress. We already discussed. We have to build the confidence of the mother since antenatal period, and as far as experience is concerned, we have to explain the position, the attachment and latching to the mother after the delivery. In babies, there may be some problem because of the baby's weight or the gestation, so LBW preterm. Thrush is a very important cause, especially the thrush in the tongue and the mouth is very important cause in preventing or causing hurdles in breastfeeding. Cleft lip and cleft palate can some extent impair or hamper the breastfeeding, but we have to keep all this in mind and manage the individual case properly. There can be regurgitation, which can be prevented by simple burping. The underfeeding and overfeeding can be there, we already discussed, you have to take care of that. There are altered bowel movements, and the child who is on exclusive breastfeeding can pass stools after each and every feed. This is known as exaggerated gastrocolic reflex. This should not be taken as a case of diarrhea. Baby can pass stool 10 to 12 times per day. Please remember the size of the breast, whether small or large, usually are not hamper the breastfeeding because the milk secretion depends on the endocrinal function and of course the secretory tissue in the breast. While the size of the breast is usually decided by the fatty tissue or the adipose tissue. Even in multiple pregnancies, twins or triplets, they can be managed totally on breastfeeding. And if the mother is pregnant again, the early pregnancy, and for any reason, if you have stopped breastfeeding, after the second delivery, both the babies can be fed on the breast. For any reason, if the breastfeeding is not possible, we have two options, that is tube feeding, nasogastric or nasojejunal, and IV fluid. Tube feeding usually depends on weight and gestation. So baby between 1200 to 1800 grams, babies less than 35 weeks, or if a baby takes more than 20 minutes for breastfeeding, then these are the indications for tube feeding. While if the baby is less than 1200 grams, initial 2 to 3 days, to decrease the handling of the baby to prevent aspiration, we can give IV fluids. Other indications for IV fluid include severe birth asphyxia, apneic attacks, respiratory distress syndrome, seizures, intestinal obstruction, and severe dehydration. And the last slide for today's lecture, for any reason, for any disease, for any problem, if the baby does not get mother's milk or direct breastfeeding, rather than giving formula milk or giving the animal milk, we have the option of human milk banks. The first human milk bank in India was established in 1989 in Mumbai Sion Hospital. Presently, there are about 75 to 80 milk banks in India. Whenever there is inability on the part of mother, if there is absence of infant's own mother milk, the donor milk offers the all other benefits of mother milk. So Government of India is coming out with Comprehensive Lactation Management Center, which is another name for Mother's Milk Bank. We need to expand our donor milk banking system. This is as a part of social accountability. And please remember, human milk bank requires will and motivation and not much of the expenses. So our vision is that we'll have at least one human milk bank in each districts of India. So for any reason, if mother's milk is not available, then we can go with the mother's milk from the milk bank. So with this, probably we'll stop here today, and next time we'll discuss the complementary feeding. So whenever next lecture is scheduled, we'll take complementary feeding. If you have any queries, you can ask. You can put a query in the question box if it is there, or you can communicate directly with the organizers for this lecture series, and we will be very happy to solve your queries. Thank you.
Thank you, sir. Thank you, sir. Thank you very much. It was a wonderful session on breastfeeding. The students should understand the very importance of breastfeeding. Then only they will advise the parents to continue breastfeeding. Hope everyone would have enjoyed the session. We will wait for another 2 minutes, sir. If there are any doubts, maybe then I will ask you, sir, in the WhatsApp section. Meanwhile, I have just an announcement to make regarding the sessions. So that was the talk on nutrition, breastfeeding by Dr. Satish Tiwari. Please do subscribe our YouTube channel, share it to your friends. It's www.tinyurl.com/Indian Medical College 2020. Share our Facebook page. It's fb.com/Indian Medical College 2020. We have announcements, and these videos are recorded and available there in this YouTube channel and Facebook channel. Stay tuned. We have a lecture on pathology, primary glomerulonephritis by Shrikant Bharati at 5 to 6 p.m. And 6:30 to 7:30, we have a video collection on clinical examination videos. And tomorrow we have a good session on anatomy, venous drainage of lower limb by Dr. Mridula. And 5 to 6 we have a talk on microbiology topic typhoid. And 6:30 to 7:30, very interesting topic, don't miss it. It is A to Z of ECG. Do share it to your friends. All about ECG by Dr. Vinod Doraisamy. He will be giving the talk. And we'll just see if there are any doubts, sir, in the chat section. No, sir. I think that's it. There are any doubts? I think we can. I will get back to you, sir, in the Facebook section. It was a wonderful session, sir. We enjoyed it. Thank you very much, sir. Thank you. And we will very soon hear from you on complementary feeding also. Maybe in June first week, we will get back to you, sir.
Okay.
Thank you very much, sir. Thank you.
Okay.
Thank you.